Professor Kerr, as both ESMO president and as truly a renowned researcher with a whole lot of experience in writing national cancer plans, can you please tell us how you see the patient advocacy community being able to include cancer survivorship issues into national cancer plans?
We've had a great discussion this afternoon, and it's a terribly important question, and there's no doubt that if we mobilise civil society, if we can in a way gather into a single choir the voices of cancer patient survivors and their family, it makes a real difference because politicians listen to large groups. I think the survivorship issue has become real because it's great to see that more people are living with cancer, more people are surviving. But with that comes some tests that we've heard about this afternoon, return to work, legislative problems as to how we can protect those in work and the time that's around it. We've heard some interesting discussions and debate about clinical trials and how we can better inform patients, get better access. And I think the best way that we can do it is to look for coordination, to see how those elements of cancer survivorship can band themselves together into action groups to work with existing communities to see how their voice may be held. And I think we can learn from others. I was very impressed with the delegates from Italy, in which clearly they've managed to persuade the Italian government to pass some extraordinarily powerful laws protecting the cancer patient, their environment, their job, their pension, even to the extent of being able to find time for their families to be able to look after them in some way. So how can we learn from others? How can we adapt what legislative procedures are going on elsewhere? Clinical trial stuff is a real hobby horse of mine, and I'd like to make a simple, bold statement. I think that if I were a cancer patient, if I were the family member of someone with cancer, I would want them to be treated in a unit, a hospital, a centre that was actively involved in research, because there's good evidence to suggest that you'll live longer and live better. The quality of treatment delivered is better from centres of that sort. So I would urge all cancer patient survivors or family to pose that simple question. If I'm treated by you, is your cancer centre actively involved in clinical trials? And is there a trial that you might be able to offer me? I think would be a very powerful message that would get out to the community in that way. In terms of my role as a practicing oncologist, is there advice that I can give to my patients in terms of what they can do to take responsibility for their own health, their own life? Yes, watch your diet, don't smoke, be careful with alcohol, don't abandon it completely, but be careful with it. Take decent exercise, and the advice that anyone would give in that way is good advice. And there's evidence in breast cancer and colorectal cancer that taking control in that way will improve the quality of your life and the duration of it. So that seems simple and appropriate. So I think a great meeting, some very strong messages coming out as always, and perhaps a single, simple closing point, band together, unify, a single voice loudly carries further in the corridor of powers than a babble of different voices raised in different ways at different times.
Thank you, Professor Dr. David Kerr, President of ESMO, and also I want to thank you for what you have done to really create a forum and the opportunity for advocates to come together and really on a level playing field with the clinicians to talk about how to bring positive and proactive change in the whole, it's the continuum of oncology care.
Thank you.
Pleasure.